My name is Richard Finn. I'm here to do a test. What I want to find out is that I've got a problem. I've got a problem with some flexibility. I don't lean over very far when I try to touch my toes. And I want to see if utilizing particular frequencies for pulse electromagnetic field therapy, if I just run the muscular frequencies, what effect that might possibly have, if any, on my flexibility. So what I did beforehand, I bent over to try to touch my toes, and what I discovered is I had a lot of pulling in my low back. That was my biggest area, was the lumbar paraspinals. That feels really tight to me. And so that's where I was feeling a pull. Now, as I kind of settled in to try to focus on what else do I feel, I felt a tightness down here where the gluteus maximus starts attaching down back into the connective tissues in the back of the thigh, in the upper portion. I also felt something along the lateral aspect of the hamstring muscle, the bicep femoris, and I felt some tugging down here in the lateral aspect of my gastrocnemius. So my big question is, can I have an effect on any of that? I generally have quite an effect on that, but I'm usually also treating upstream, trying to calm the nerves, trying to calm down the spinal cord. And so right now, just focusing on muscular frequencies, because that's not something that's generally done, I want to find out, is there any change whatsoever? Let me show you what this is going to look like now. I'm going to stand up here. I'm going to come down and see where I am. And over here, this tells me I'm at 22 inches or so. That's not particularly accurate, but that's okay. That's what I'm using to measure with. So we're going to find out what happens, and what I'm going to be doing is I'm going to be using the eye care treatment device. It's the PEMF machine that works with a telephone or a tablet, and I'm going to be treating my low back, my hamstring, and my gastrocnemius muscle, and we're going to see if this makes a change. Okay, it's time to come back and see what has happened. I spent about 45 minutes receiving the PEMF treatment with the eye care self-treatment device. I worked with my lateral gastroc. I worked with the lateral hamstrings, the gluteus maximus, specifically the fibers from the coccyx area and from the sacral area. And then I did all of the lumbar musculature. While that was happening, uncharacteristically, I also began doing some unwinding in those areas, as well as up in my shoulder. Don't know why that would be, but anyway, that's where I'm at. Let's take a peek and see what's happened. Oh, and again, those numbers came out of this book here, the Electroherbalism Frequency Lists, 3rd edition. It says the name is Brian McInturf. So that's where I received those numbers from. They are not normal FSM numbers, but that's where I got them from to get the idea to see what would happen. I will say that I have also used these numbers specifically with people with contractures and gotten some good results. So I'm expecting something here. There we go. Okay, that looks a lot different. When I come over here, it says I am down to 15. That's a rather significant change for running numbers that we're just not familiar with. I will say I did not use any 62s. I did not use 46. And that was specifically because of this particular test. On a normal kind of treatment, I certainly would have included those. I also would have included taking care of the nerve. I would have included taking care of the cord. I would have done something with the brain, perhaps. I mean, I would have done a much more full-fledged treatment. This was only a test. I hope you go out and do a test too. Thank you so much for watching.